Okay, I'm getting marching orders that we can start our meeting today, and I'm very excited to greet everyone, including our distinguished panelists, Dr. Sania Nishtar, Pia Andrews, Dr. Jemilah, and our moderator Tariq. Really very much appreciate your participation and joining us for this meeting, as well as very happy to greet all other attendees. Just maybe a couple of words from me at the beginning. I'm Alexandru Oprunenco. I'm part of the regional innovation team at Bangkok Regional Hub of UNDP. At the hub, we have launched the NextGenGov Asia initiatives several months ago. Some of you have attended the NextGenGov Asia Summit in June. And we really are very happy that this journey that we started in June is continuing and is getting more and more closer to practice. Just as a reminder of why and how we started this initiative, before I hand over to Tariq, who will be moderating the meeting today. I think one of the I would say there are four key reasons why what we observed and what we wanted to achieve through the NextGenGov initiative when we started it. The one was as part of the response to COVID-19 pandemic. I think what we wanted to debunk is usual attention and kind of a role modeling to follow that would come from the West. We believe that there is a lot of great experiences coming from Asia and from the East as well. And we wanted to give to those more attention and more scope. And I think with these several months since then, I think we can happily check the box. I think there is a wide recognition. There is much more lessons coming from other regions, not only from the West. The second big objective for us was really to focus beyond quick fixes. What we have believed and believe until now, that the new governance models that should be succeeding in the aftermath of the pandemic should be really transformative. And while a lot of the attention at the beginning was to digital tools and to apps, what we believe very much that no less important would be things that relate to governance as such. Whole of the government coordination, engagement of the private sector, engagement of citizen participation, ultimately citizen trust in what the crisis and post-crisis response might look like. And I think we very much will be reflecting on this at the meeting today. I think another important thing for us was we observed a lot of large-scale innovation emerging in the aftermath of the outbreak of the pandemic. What we really wanted to see, how that innovation dividend can be retained and how it can be taken forward for shaping policy transformation that would be, in a way, overcoming the weaknesses that were highlighted by COVID, and would help us all build a much better and more fairer future for us. And I think this is where again, this conversation will be pushing the narrative and the thinking and doing going forward. And I think the last thing, what was really important for us, is to support the cross-country learning. What we felt at that particular moment, that a lot of governmental responses have become very much inward, as the crisis management objectives took hold. What we believe there was a lot of learning that could be very instructive, could be very guiding and very supportive, as those societies and governments were kind of overcoming the shock experience of COVID-19, and were kind of laying foundations for a longer term not only crisis response, but actually building a very different recovery than the one that the world that was before pre-COVID. So I think those four frames still hold and very important for us. And I'm very happy that this meeting will be in particular looking at the combination of several key elements. One is really these transformative effects of government, whole of the government's different use of data, engagement of private sector and citizens. On another side, how digital infrastructure and approaches can support those transitions. And I think ultimately, what is not less important, how this will be applied to the area of social welfare. To what extent we can use these new breakthroughs to put in place social welfare that is fairer, more inclusive, and more sustainable going into the future. And obviously, what is really important, this is just one of the conversations that actually lays ground to practical work. We're really looking forward to how we can start forging those large-scale transitions going forward. With this short introduction, I would like to hand over to Tariq to introduce the panel and to kick off the meeting as such.
Thank you very much, Alex, and welcome everybody in whole of the government in social protection in times of shocks and after discussion. I'm honored and privileged to introduce three superwomen and very accomplished individuals who are making social protection at the horizon of pandemic, COVID-19 pandemic. So we have Dr. Sania Nishtar. She is Special Assistant to Pakistan Prime Minister Imran Khan on poverty alleviation and social protection. She is also chairperson on Benazir Income Support Program, where ESAS program is anchored. Dr. Nishtar was named recently in BBC's list of 100 inspiring and influential women from around the world for 2020. She's doctor by profession, cardiologist, and winning hearts and minds of poor people of Pakistan. So our next speaker is Dr. Jemilah Mahmood. She is special advisor to the Malaysia's Prime Minister Tan Sri Muhyiddin Yassin on public health. Dr. Jemilah was the Undersecretary General of Partnership of the Internal Federation of Red Cross and Crescent Societies. She also won ASEAN Prize, if I remember correctly, in 2019, an award aimed at recognizing individuals, organizations that contributed to the development of the ASEAN community. And she's doctor as well. Pia Andrews is very popular in my community where I come from, tech community, digital transformation, and she is special advisor to the government of Canada. I'm covered, by the way, I'm Canadian Pakistani, so we have two panelists who cover both the countries. And Pia is an open government, open data leader, and we call her ninja instead of leader. She has been extensively involved in policy development, ICT industry, public sphere, and on digital culture. And she has done a lot of work in tech sector in Australia. And so we have an honor actually to have her here to talk on social protection and especially from technology platform perspective. So I'll start with Dr. Sania Nishtar, and I want her to share the whole of government approach in designing and rolling out a ESAS emergency cash program, the largest social protection program in Pakistan's history. The program commenced just 10 days after the lockdown began, delivering one-time cash grants totaling more than US $1.2 billion to more than 16.9 million households, covering 109 million people, and that's approximately 50% of the country's population. So Dr. Sania, we want to learn what's the current social protection landscape in Pakistan after you give overview of the program, and what are some of the key challenges with social protection today that need to be improved for social protection regime in the country. Dr. Sania, you have the floor for next 15 minutes. Thank you.
Thank you very much, Tariq, and thank you, colleagues at UNDP. Good day to all of you. It's both a pleasure and a privilege to connect and be on the panel. I mean, I've worked in the UN system as an external commissioner, member of expert working groups for a very long time. And we've always talked about public-private engagement and the whole of government approach. My background is in non-communicable diseases in the health sector, and the whole of government approach was like the commonest jargon that we used. But to see it actually come into play was something that I touched during the rollout of ESAS emergency cash, which I'm just going to talk about. But before I talk about the whole of government engagement in this particular program in the COVID context, I'd like to give you the context. What was emergency cash? How was it conceptualized? And what was the parent program that gave birth to ESAS emergency cash? So ESAS means compassion in our local word Urdu. And ESAS is the name of a very large, integrated, multi-component, multi-sectoral program aimed at targeting 14 different vulnerable groups through 140 programs, policies, and initiatives. It's a program that was conceptualized in 2019, and we had to develop an extensive institutional infrastructure for that, comprising a new ministry, a massive budget, digital capabilities, a new governance policy, and an integrity observatory, and a whole host of other things. When COVID-19 struck, we were 6 months into the implementation of the program, and we were looking at a very serious context. Because we all know about the dire health consequences of COVID, but the fact of the matter is that COVID has decimated livelihoods at a very unprecedented scale. In Pakistan, according to estimates, there are 24 million breadwinners who are either dependent on daily wages or piece rate remuneration or are employed in Pakistan's very large informal economy. So according to estimates, 2/3 of the population was affected. In response, the government of Pakistan, alongside its larger COVID package, allocated $1.23 billion, and it entrusted our ministry to deliver one-time emergency cash assistance to almost 17 million individuals, vulnerable families. So the mandate was to give them $75 for immediate subsistence. Now, what we did was that we joined the dots between 3 sets of digital capabilities that we had developed over the last 6 months. The first one was a biometric payment system, which had the ability to verify identities in real time. The second digital capability was a demand-side SMS-based request-seeking platform. And the third digital capability was a new wealth profiling big data analytics mechanism. All these 3 had been developed standalone. So we joined the dots between these 3 digital capabilities. And basically, within 10 days, we installed a new system. We used a hybrid targeting approach, combining emergency assistance for the known vulnerable and demand-based support for the new poor. But there were 12 million new poor who received assistance through this program. So the predominance was that of the new poor, who raised their hand by sending us an SMS. So requests were sought through an SMS shortcode service. Data analytics enabled eligibility ascertainment using unique national identification numbers. And we also drew on the National Socioeconomic Registry. And in addition, we also used a number of wealth proxies: travel history, taxation history, your billing status, asset ownership data, government employment status. The system that we developed was end-to-end digital. It was fully automated. It was rule-based. It was fully transparent, right down to the amount of monies that were going to the smallest subnational unit. And because it was politically neutral, we were able to garner the support of the different subnational factions in Pakistan's very large and vibrant federal polity, where different political factions govern different subnational groups. Now, once this entire value chain was created, the end point was payments, which, as I've already mentioned, were biometrically verified. So just to give you a sense of the scale of appetite and need and utilization of the system, we received 139 million requests, of which 66 million were unique. 16.9 million individuals were declared eligible, and at the end of the day, 15 million collected their money. We disbursed 180 billion, which is over $1 billion. And there were special arrangements made to pay those who suffered biometric failure. There were 3% of individuals who suffered biometric failure. And then we made special arrangements to pay the next of kin of dead beneficiaries, because this was an automated system. So of course there were notifications going to dead beneficiaries as well. There were a host of challenges that were encountered during the disbursement process, because the largest social protection operation in the country was being rolled out with lockdowns in effect, with public transport suspended, and with the risk of disease looming. So you can imagine the scale of the challenges in which we were operating and disbursing this largest wave of assistance. There were additional challenges related to issues of logistics, connectivity, liquidity, cyber attacks, biometric failures, as I've already mentioned, and limitations of data-driven messaging, as evident in notification to dead beneficiaries. And we really used a whole of government approach. There were two things that really helped us. One was a whole of government approach, and the other was real-time evaluation. This was the first time. I'm an academic by background. I'm used to case control studies and to RCTs and to cohort studies and to process evaluations. But this was the first time as an implementer I saw the power of real-time evaluation. When you have the commitment to be on ground and the agility to learn from lessons on ground and the swiftness with which to take decisions, the impact of such large-scale programs can be very profound. So I want to come to the whole of government engagement, but I cannot help resisting and sharing with you how humbling the impact of this program was on ground. You know, getting cash into the hands of millions of families at a time of extreme uncertainty. It was truly humbling. So laborers without work for decades, their families on the verge of starvation, hawkers forced out of work because of the lockdown, staff from otherwise busy hotels and restaurants sitting at home, domestic servants, part-time gardeners, drivers, security guards. Depending on where you were, there were fishermen and miners and transport contractors and bus drivers and beauticians and barbers, otherwise making a decent living, suddenly at the verge of starvation. There were millions of shopkeepers with shops closed. There were private school teachers with severance letters, electricians, welders, painters, car mechanics, construction labor, taxi mechanic, taxi drivers. I mean, there were millions of people in camps where we went for whom this $75 was lifeline, and it brought them.
I'm hosting a webinar.
So this really brought them stability and comfort. So there was a pulse telephonic survey which we conducted while the operations were ongoing, and that showed us that 97% of the beneficiaries had consumed the full amount, and 93% of it spent on food. So I come now to the whole of government collaboration part. There were many government agencies that we were collaborating with and with which we had complex interdependencies. The National Database Registration Authority, which Tariq helped set up about 2 decades earlier, we were working very closely with them. They were validating information and biometrically authenticating our beneficiaries. We worked very closely with them. And if my staff was up all night, their staff was up all night too. We worked as a team. Secondly, we were dependent on the Pakistan Telecommunication Authority because as part of our data analytics system, we were using telephone billing data, and they helped us access their data very swiftly. We were also dependent on the revenue agency because we use their data for data analytics as well. We were dependent on the Controller General of Accounts because we got the payrolls for them to sift out the government servants. We were also dependent on the Central Bank of Pakistan because there's a huge amount of liquidity that had to go out in this fifth largest, most populous country in the world. There's a huge amount of liquidity in a very difficult terrain in a COVID situation. Then there were layers of government, the provincial government, there were local governments, there was last mile government because there were camps that had to be set up. And all of them were mobilized. Then there were public representatives, political actors who played a very politically neutral role by standing at the camps and helping facilitate people and making sure that there was water and shelter and the rest that is required. We were also dependent on law enforcement agencies, and there were layers and layers of those who helped us. I had to deal with 5 cabinets while I was rolling this because we had to make certain changes we had to take some fiscal measures to give our retailers, these were agents who sat in our camps, a better incentive. So I had to go to 5 cabinets to get those decisions. And of course, when you go to the cabinet, there are 3 or 4 layers, 4 government agencies that you have to go by. The communication apparatus of the government of Pakistan, every morning, Radio Pakistan gave me 1 hour on live national hookup. Every radio station heard our voice about Asas Cash. Television gave us space whenever we wanted it. And then, and I hope I'm not forgetting anyone. So there was a whole of government mobilization for this effort. We were standing on many shoulders when we took the credit for this. The actual fact of the matter was that we were able to rally the support at a very difficult time. But we were able to coordinate at a very difficult time because this was an emergency. And we knew we had to do something quickly. There were COVID-related coordinating platforms which helped as well. But I don't think that the same level of mobilization can be garnered without special efforts outside of an emergency. I'll come in a moment to what I think about that. But because Tariq talked about, and I just made a note, new governance models and the need to be transformative, and I think Alex talked about whole of coordination and what this experience means for the future. I'd like to tell you that for us as a government, this was quite a watershed moment because it made the government more agile, more data-driven, more experimental, more ambitious. It helped us fast-track adoption of cost-effective digital ways of working and new ways of coordination across multiple stakeholders and deploying a whole of government approach through that. Because normally, when you don't have that pressure of an emergency, there isn't this sense of urgency to embrace things that are new. You take your time, especially in a government system. But this really helped us to transform into digital government literally overnight. This helped us to be more agile and to embrace data as our key lighthouse literally overnight. And I think it really bolstered confidence in the government's ability to execute well. I think the whole nation started looking at the government in a very different way. The impact that it has had on cementing trust between citizens and the people has been very profound. Here is a government that cares for you. And here is a state which has the ability to rise above politics and differences and trivialities and to help you at this very critical moment. I think that is the most important legacy of this program. I now come to the out of emergency situation, if I have a couple of minutes. And sorry for being self-reflective, but I go back to 2013, which is when I worked in the government for the first time in a caretaker in a caretaker cabinet role. I was in the position for 3 months, looking at being in an interim government, but I looked at the government workings very closely. When I stepped down from my government position, I wrote a paper in the Lancet, Reflections from My Tenure as Minister. You can still Google it with my name. And basically what I was saying, and the reason why I had the insights which I reflected in the paper was because I had 4 portfolios: science, higher education, health, and information technology. And my key takeaway, which I reflected in the Lancet paper, was that the government is not one entity. It's an archipelago of many institutions which have a disincentive to collaborate. But conversely, most solutions in the government system can only be brokered through intersectoral collaboration. And my crux was that there are no incentives within the government system to forge that. So just to conclude and to reflect on what I recommended in that paper, which I think still holds true, is 4 things: that governments need intermediary agencies, skill to convene and facilitate trust building. And we acted as that agency during the operations of emergency cash, number 1. The second was that we need instruments that can enable asset allocation mapping. The third was that we need incentives for collaborative division of labor. And the fourth was that we need metrics of whole of government performance assessment. And I think that this holds true for international agencies as well, because work is so siloed. The accountabilities and the incentive structures are so vertically siloed that it really precludes us from everyone to be working together and to be exploiting synergies, and leads to a whole host of duplications and fragmentation. So that was basically my takeaway. And the reason why we were able to break that in the emergency situation in COVID was because it was an unprecedented emergency. We created the instruments for collaboration. And I think post-emergency, we have tried to cascade many of those instruments in our normal ways of working. We have come out of that emergency as a ministry with a very different flavor of work, which I hope that we will be able to sustain. So I may not have answered all your questions, but I'm sure that
we'll come back to the questions. Thank you very much, Dr. Sania Nishtar. I really like the fascinating approach, whole of the government approach, and your connection, which what I have written on also, the social protection has a real connection with social contract, because I think a weak social contract in the context of crisis poses real risk to social cohesion. And COVID-19 has actually exposed the fragility of that weak social contract. I really liked how you added 12 million, I guess you said 12 million new beneficiaries using end-to-end digital system, including, you mentioned SMS-based approach of data collection, and time to ponder on challenges like biometric failures, cybersecurity. And then I like the Pulse survey, because that was a real good citizen engagement tool. And we have learned how interagency cooperation, like between NATRA, State Bank of Pakistan, Revenue Department, Ministry of Finance, banks, all the way to the last mile delivery in the camps is important. So let's move from whole of government to whole of society approach. And I invite Dr. Jemilah Mahmood to share Malaysia's social protection initiatives for the immediate and urgent recovery interventions. Additionally, I'm personally interested in what I really liked about Malaysia is Sukuk issuance to support underprivileged communities. Dr. Jemilah will share the digital vision and action plan, what we call whole of society approach, as I mentioned earlier, including a new platform for coordination in government, private sector, and civil society using data-driven platform aimed at enhancing accountability and capacity development. So, Dr. Jemilah, you have the floor.
Thank you very much, and good evening, everyone. I really enjoyed listening to Dr. Nishtar and learned so much from your intervention. Malaysia also suffered from the COVID-19 pandemic, and as a result, it was not just affecting individual levels, but also businesses, loss of jobs, loss of income. Malaysia has in 2016 established something called the Social Protection Council, and that looked into particularly 4 areas, looking at social assistance, social insurance, looking at labor and data market interventions, as well as the overarching governance. But it wasn't really active, and I think because of COVID-19, it has resurface and really had a good kick in the butt, if you say, to re-energize and to be led, in fact, by the Prime Minister himself. So what happened immediately in the aftermath of our first rise in cases in March itself? We had the government established something called the Prihatin package. Prihatin in Malay, it means caring, and what it is essentially is an injection of about 250 billion ringgit, which is about $40 billion US, which is 3 times more than what was injected during the financial crisis in 2009. And it was really, ensuring cash flow to people and businesses, not just people. I will emphasize also to businesses. And the thrust of it is really protecting the welfare of people, supporting businesses, and strengthening the national economy. Initially, it was cash to people, but and these were, actually reached about 96% of the population of Malaysia. And like what Dr. Nishtar mentioned earlier as well, we did touch points with the communities, tested the waters, took the pulse, and it was very well received. And what we did initially was, in Malaysia, our social protection system has what we call the B40, the bottom 40%, and we call them M20, the middle 20%. And we already have databases through our welfare programs and so forth that we could reach out to these people very, very quickly. But we then looked at, how do we then provide wage subsidies for those who had either lost their jobs or those who could not do their work. And there was also incentives like deferment of tax, deferment and waiver of rental expenses that were belonging to the government. We had loan moratoriums by the bank, and then the Employers Providence Fund, which is really where the savings are kept, and that insurance system, so to speak, for people with an account, they could withdraw. And they realized very quickly it was a small, medium enterprises that drive the economy in Malaysia was so badly affected that another package then was raised for the small, medium enterprise. So we had a variety of packages. Now, one of the things that Malaysia then experimented with was, will the communities themselves, come forward and look at supporting, the people who were suffering from COVID-19? And that was the issuance of the sukuk, or the Islamic bond. And they call it the Prihatin sukuk, the caring sukuk. And initially, the issuance was targeted for 500 million ringgit, and it was an open government issuance for either retail, it could be a retail sukuk or corporate sukuk, to get the investors. To the surprise of the government, it was oversubscribed. So from 500 million, it was expanded to 666 million ringgit. And it actually rallied all society support, and with a 2-year payment period, a lower percentage return, 2% quarterly payments. But it was very interesting to say, even that in that time of crisis, people will invest in the sukuk and as well as corporates. And the purpose of the Sukuk was really to look at connectivity to rural schools, because one of the problems in Malaysia is that internet penetration, while is excellent in the cities, it's still very, very poor in rural settings. So a lot of the education facilities affected. And also looking at, COVID-19 expenses and also grants to micro enterprises, particularly women-led micro enterprises and so forth. So that was quite a success in the sense that, it was a social sort of Islamic structure, but it worked. And then we implemented something else called Penjana, which is the National Economic Recovery Plan, having gone through that first phase of the shock and providing the cash and so forth. And it has 3 trusts. It has looking at empowering people, propelling business, and also stimulating economy. So then it used reskilling and upskilling of people, because obviously, some of the industries are so badly affected. I'm sure in your countries as well, things like tourism that are most badly impacted. So it was finding not just the young people who are unemployed or young people coming out of universities, but those who had to be reskilled. And there was a good private-public partnership as well to say that they would be reskilled, but they would find, companies and agencies and so forth that would want to have the skills. So there's already an agreement up front so they can then be placed. Because one of the challenges with capacity development is you train people, but they have nowhere to go. So really thinking ahead and looking at the jobs for the future. And this is where I think digital, the use of the digital transformation is very important. We have the Malaysian Digital Economic Corporation, and a lot of work was done there to retrain on e-business and so on and so forth, really understanding the commercial space. Apart from that, it was also giving again livelihood development grants and working quite a lot with foundations, civil society, not just government agencies doing this. Now, one of the very important factors, and I really love what Dr. Nishtar said about how do you as a government come together and work together across agencies. Now, Malaysia is quite unique. You may have followed the news. We've had changes in government in the middle of a crisis. And of course, trust, to build trust is extremely important. It's a coalition government, so to speak. And what happened is very quickly, with this instrument and also the Prime Minister taking charge and bringing together the different ministries and the ministers, on a daily basis, having meetings until today. We are still having, 3 times a week, Prime Minister chairing a meeting, really having an economic action council that will include not just government agencies, but also the private sector and civil society. So really bringing all these components together. Now, I mentioned about a digital platform to bring in all of society response, because in the management of pandemic, there is a health aspect, and then there's the social protection, economic drivers as well. So on the health aspect, obviously the Ministry of Health takes the leadership role, but in the pandemic management, you can't manage a pandemic without people actually participating. It's about changing behaviors and so on and so forth. And if they are looking for, sources of income, they're likely to, not follow some of the public health measures that are required. So I think very important empowerment of communities, and this is where, the civil society can play a major role. So upon the start of this, and I have started my job in April, I come with a civil society background as well. So we talk to the private sector, talk to the government agencies and say, how about all coming together, and what will enable that partnership? And it will be digital and data. So very quickly working with the private sector to build a platform that we call the Malaysian Action and Coordination Hub. And what it has is really the private sector driving some of the data-driven, good practices, the government's providing data, civil society who are delivering assistance on the ground, uploading data. So trying to build that transparency and that chain of, where assistance goes to. It was very interesting that this is the first time we've ever had such a platform in Malaysia. And I think it's also very rare in the rest of the world to have a platform where government, private sector and the civil society share data. And what it's been able to do is, because it's categorized by postcode, you could actually see which communities were less served or where there was duplication of effort. So it's really to streamline, and also, we want to use it in long term to look at capacity development, accountability, and so forth. So I will say that, I completely agree that it's very difficult to find incentives for collaboration, and much easier to find disincentives for collaboration, because there's a tendency to fall back on a siloed approach to things. But one other area I think that we need to work with, and I love what's being done with ESAS, is that bringing in also the faith-based funding, right? For us in Malaysia, is like the Baitul Mal, the Zakat institutions, the Wakaf, and so forth. So in Malaysia, we collect a very decent amount of zakat. We have institutional collection. People can actually use digital online payment of zakat. You can use zakat. Zakat can be paid. Also, payment of zakat is also a tax break. So you can actually offset your tax by paying zakat. And having that digital platform where you can do things online actually really drives people to pay their zakat with the incentives there. So I think once we can bring all this together, and nothing digital beats engagement, right? Engaging with people. So I think this is where the use of social media, making sure that all these packages that I mentioned before are known to the public. The public can give feedback. Also, the Ministry of Finance going down to the ground, the minister himself going down to the ground to talk to communities that were in the lower income groups, to see how it's been impacting them, and are these packages useful to them, has been also very important. So I think there's a lot of lessons we can learn from here, but more importantly, the Malaysian Social Protection Council now has to have teeth, and this is going to be chaired by the Prime Minister. It's got all the different agencies, and the digital vision that we're building now has to incorporate social protection as well. So I will pause there and thank everyone for this opportunity.
Thank you very much, Dr. Jemilah. We learned B40M20 initiative, and I think it's fascinating. The bottom 40% and middle 20%. So at least Malaysia is a step ahead in terms of addressing the woes and concerns of middle class as well.
Yeah.
And I liked the approach of addressing SMEs also, because SMEs are badly affected, and you mentioned that they received a package as well.
Yes.
And the microfinance grants for women. So moving on to the across the Atlantic Ocean to Canada, and let me wear Canadian hand. Pia, the lockdown throughout the developed world, if we talk about developed world, are creating a new type of what I call brutal inequality between those who actually continue to have a steady source of income and those who don't. So the latter group actually includes not just the already poor, but the millions across Canada who are now at the risk of falling out of the middle class. We see I saw when I was there in Toronto, laid off workers, daily wages, whose unemployment checks will not cover the rent, or the drivers, small business owners, performing artists, writers, childcare workers, at-home parents. They cannot now afford living, So, and then there is a whole of society approach, which is working sort of without government in Canada, which I feel is a thing that rest of the world should learn. It's called what we call people-to-people social protection, right? It can also be about sharing the pain, sharing skills. I saw teaching, for example, English to new migrants in Canada, tipping generously to food delivery people, considering no interest loans, so on and so forth. So, and from technology perspective, I see a lot of, skills training programs coming out where people are actually learning the digital skills. So tell us about the landscape of social protection from the prism of a developed country like Canada.
Thank you so much for that, Tariq. I also want to quickly start by saying just a big acknowledgement to my fellow panelists. I said in the chat earlier on that I feel like a small planet between two very bright suns, and it's a huge privilege to be on this panel with you both. In Canada, the policy response, and I'll just quickly say I'm not here to speak on behalf of the Canadian government, but the policy response has been quite thorough in that it did try to cover everything. It tried to cover immediate emergency payments to people. It tried to cover various different loan subsidies and rent protections and eviction protections, business benefits. There was quite I think quite a human-centric relief package put in place. But I actually might focus my comments a little bit on the transformation impact on government, because I think the public sector has been through, in trying to respond to this crisis, a few interesting changes, which is worth highlighting. First of all, the pressure every day of the number of people, particularly back in March and April, when it was starting to expand very quickly. It was very interesting to work as I was on one of the teams doing one of the COVID social service benefits to put in place. Normally these benefits and the policy through the delivery process is very slow. Policy might take a year, delivery might take another year. Suddenly we had we had 100,000 people join the unemployment queue last night. We had 150 today, and tomorrow we'll probably have 200,000. It was going up so fast. And so when people would say in the process of trying to deliver these benefits very quickly, well, we must do this process, which will take 3 months. And we could very quickly calculate out, can you seriously say that many millions of people should be doing without because you want to go through a process that does not deliver value, does not support those people? It focused everyone's minds under that sort of pressure to use various emergency powers, to drive delivery quickly and to close the policy implementation gap. I think everywhere in the world we've seen that gap increased, where policy happens on one continent and implementation and delivery happens on a different continent, and the bridge between them has got more and more tenuous over time, so that it is barely existent. I think under pressure, it drove those two continents together so they could actually be one landmass. So it drove speed of response, it drove use of emergency powers. We saw our department, so the Department of the Social Services Department, which is ESDC, 100% of those of that department was working from home almost overnight. We saw all of our front doors have to close for completely appropriate reasons, so they didn't become places of infection or places of spreading the virus. So the whole organization went to working from home overnight, which was huge. It shifted a lot of our call centers. It shifted the work culture. It shifted the opportunity. We saw the starting to shift more to the two things in Canada that really helped was the social platforms, if you like, that they had. So Service Canada as a platform, Service Canada as a concept is really that idea of, hello, welcome to Service Canada, how can we help you? It's not, how do I just shift you into that service or this benefit or that benefit? It's very much a, tell me a bit about your situation. I will figure out all of the benefits, all of the services that are relevant to you. That framework of holistic service obviously came very much to the fore in this kind of emergency, because we already had a culture of we will figure out what you need. That same model is actually in service New South Wales, one of the provinces in Australia, which I'm also quite familiar with. The second one, of course, is the All of Government website, which then provided a very rapid response and information basis for people, not just to find out about relief and support, but to find out about COVID and to find out about the situation in Canada. So they set up a lot of information flows to the media and to the news and to the internet. So that really helped with information dissemination. I think a couple of interesting things I wanted to raise in this are, first of all, before COVID, something like 40% of Canadians were within $200 of bankruptcy before the emergency. So we have already, some of the earlier points that were made about the fragility of the system as it was pre this emergency, and it's only obviously got worse. So COVID has kind of done three big things, I think. It has, first of all, exposed gaps by putting massive pressure on the system and making the gaps so much more obvious. The second thing, it's created an appetite for change, a real appetite for, obviously this isn't working, we need to change, but paradoxically, it's also driven massive iteration on the status quo. So where we have invoked emergency powers, we are now starting to see, okay, now how do we get back to business as usual, and people starting to see the usual systems reinstate themselves, and those systems quickly reasserting themselves is missing the opportunity of transformation. The other one is bots. So of course, as new benefits came out, they were being gamed. As fast as new integrity rules are added, they are re-engineered by bots and by programmatic, I guess, attacks. And that is a real challenge, because a lot of the systems of government assume that there is a person behind an action and that you find and address a person. But if it's a bot, then the speed of response is no longer sufficient. We need to have real-time monitoring, real-time response, patterns analysis. We need to be able to fight, if you like, bots with bots, and government needs to get better at that across the world. And I wanted to, and there were other challenges from a policy perspective. Obviously, when you get money out the door very quickly, there will be some cases that don't go well, and it's not so much about, it is, I believe, worth that cost to get the support into the hands of the vast majority who urgently need it. But at the same time, when the media jumps on the small number of cases where it hasn't gone well, that is a challenge for the public sector to deal with, which is different from the political sector. The appetite for hitting the front news in the public sector is exactly tethered to the appetite of whomever their minister is at the time. So that's a little bit tricky. Some companies collected salary subsidy, and this is around the world, but still let people go. How do you deal with that, and how do you drive the right policy outcome? I'll quickly just refer to a couple of relevant initiatives in New Zealand that I thought were very interesting. So in Wellington Council, which is a very big area, they recognised quickly that COVID spread by people who were very vulnerable, particularly homeless people, might actually be a significant issue, but also just with the additional pressure on everyone, the quality of life was going to get a lot worse. So they actually very quickly created some of their publicly owned housing, and publicly owned buildings were transformed into new housing complexes. And then they provided housing to a lot more homeless people very, very quickly in the city. And there were a lot of community organizations creating meals to children who weren't going to school, because there were a lot of kids who were getting their substantial meal at school in both Canada and New Zealand. So to see the social sectors stand up and start providing meals to children because they weren't getting their meals at school was quite heartbreaking, but necessary. And finally, Indigenous communities in both Australia and New Zealand. And I'm not so sure about Canada, only because I had only just started. But in Australia and New Zealand, a lot of Indigenous communities just closed their gates, said we need to protect our people, and in New Zealand, that the New Zealand police actually supported those communities to do that, supported the roadblocks, and supported their need to protect their communities. So I guess the final comment I want to make before we jump into the rest of the panel is this. Around the world, many governments bought into the notion that we needed to prioritize on efficiency and effectiveness in public sector. And this laser focus on efficiency, I believe, has created, a trimming of the fat, getting rid of the waste. But the challenge is that there is a reason why we need fat. And when you trim too much fat, then when you get to the winter, you don't have your buffer. And I think these emergencies have become our winter, and the exuberant trimming of the fat of our public sectors has actually resulted in a very lean animal that is not as resilient to the winter. We need to make sure that we don't just focus on efficiency or the business motivations for the public sectors, but the actual role of the public sector in the life. And I really appreciated and loved the comment from Dr. Nishtar early on that it's changed what people see of government. I think in a lot of developed nations, it's possibly changed it not as positively because people have seen their governments try to respond but get limited by some of these positions of what's good for the economy, but not necessarily what's good for the people. And in Canada, I think they've had a really humane response, and that's been relatively well received. But I certainly am seeing different perspectives in different countries around the world, where if you focus on just the economy but not the people, how can you have a strong economy if your people are suffering? Is I think a question of sustainability and resilience. So I'll leave my comments there. I hope that was helpful. I look forward to the questions.
Thank you, Pia, for sharing not only Canada's Service Canada initiative platform addressing unique needs of the citizen, but sharing how COVID-19 exposed the gaps, created appetite for change, and challenged the status quo. Additionally, you mentioned New Zealand. Also, I like the initiative of housing complexes for homeless people, how quickly that they have come up with and initiated the meal service for the children. And you mentioned Australia's lockdown also. But the real takeaway is your comment regarding the lag between policy and service delivery. It is very important that the due diligence that is required should not be overlooked for targeted beneficiary approach. And that's where Canada emphasizes it much. Now we move to the questions. Questions started coming in, but I will give floor to Dr. Sania Nishtar, and she can ask more questions. But my favorite question is actually, how do you protect or insulate people from shocks? I mean, how do you protect vulnerable people from shocks, and what does it mean for social protection? In the experience from Pakistan, we want to learn how Pakistan actually ensured that the programs being run by different implementation agencies are working in sync and contribute to the other countries that we have learned overall social protection objectives. Dr. Sania Nishtar.
So first of all, thank you, colleagues. Thank you, Jemilah and Pia, for that very insightful conversation. I learned a lot from you. In terms of your question, Tariq, how can you insulate people from shocks, and how can a social protection system be responsive to that? I think, first of all, we have to categorize. So catastrophic shocks is not a monolithic event. And I think that first you have to bring some granularity to the kinds of shocks we are talking about. There's and I'm outlining some in no particular order and just as a knee-jerk reaction to your response. So there is a category of shocks which people experience as a result of catastrophic climate events, for instance, or catastrophic or events such as earthquakes. There are events which are large scale and sudden and unforeseen. And there's a different kind of risk which lead to displacements and suffering, and the vulnerable bear the brunt. And in Pakistan, we've seen a lot of those. You know, there are earthquakes and flash floods and unexpected rains. There's no element of predictability. There's mass displacements, deepening of poverty. There are, of course, law and order and security related events that I'd put in the same bracket. So the outcome is mass displacement, deepening of poverty, and there's a requirement for a humanitarian response. And there are actors who are good at this response. There are institutional entities of the government who are purpose created for this. In Pakistan setting, there is the National Disaster Management Authority, and after our earthquake of 2005, there were special instruments. There are special frameworks that deal with it. There are special funds that are created to cater these situations. There are special drawdown mechanisms. There are special governance arrangements. Then there are other catastrophes, mass catastrophes, which is slightly slower motion, which allow you some time. Catastrophic risks such as droughts or a locust attack, and these kind of things give you some or a flood that you foresee, and these kind of give you some reaction time. But then there are but those are not on the plate of social protection agencies. Social protection agencies such as like mine are only called into play when their instruments are needed. Our cash machine is required to make payments to those displaced in an earthquake, and that would be our role, but we would not be the steward in a humanitarian setting. That is how I see it. But our role is to make social protection responsive to people's need. Not just have a static list that you can continue to tick off quarter after quarter, year after year, and say you've ticked the box. But a social protection system that is responsive to all kinds of catastrophic risks. So if that is the context, what are we looking at? When I look at data in my country, the number one cause of individual catastrophic financial risks is medical related. So if a family has a patient with cancer or diabetes requiring dialysis, have a child with congenital heart disease that requires aortic valve replacement, that's a family that will fall below the poverty line or forego treatment. You need instruments for that. Insurance inherently is not responsive to catastrophic expenditure risks in the medical domain. So in the Asas basket, we created Asas Tahaffuz, which is one program which is yet to be deployed. We've been working on it for the last 2 years, building the systems and structures and platforms. And that is a supplement to insurance, to wholesale insurance, medical insurance that you typically deploy in a mixed health system of the kind that we have. That is one category of protection against catastrophic risks. There are other catastrophic risks that are very pressing. A woman needs legal aid. She's out on the street. Her husband has abandoned her. Does the country have a legal a door that she can knock on? Is there a protection home that she can fall back on? Is the state going to pay for the lawyer's fee? There are instruments, special instruments we are creating for that. then there are catastrophic risks related to a sudden change in the situation of a family. In our patriarchal culture, if a woman gets widowed, she needs assistance, and if she doesn't have the ability to earn, she needs assistance. If a breadwinner dies, that family needs assistance. If a breadwinner loses a job, they need assistance. And in order to have the right systems and structures for that, you need to make your registration, your social registration system dynamic. Now, Pakistan had a static registration system for the last 10 years. A survey was conducted in 2011, and the list of assistants was just pegged to those who were declared eligible at that time. So the fundamental policy shift that we have brought is that the registration is going to be not static, but dynamic, which essentially means that, number one, you continue to survey different districts at different points in time, cyclically. Your survey never finishes, number one. And secondly, you open registration desks at subnational level, which will allow deserving individuals to raise a hand and say, well, my situation has changed. I have a disabled child in the family now. My husband is no more alive, or a breadwinner has died. And then the ability to change the status of that family without political influence, without undue influence, and in a transparent, verifiable manner. So that is the transitions that social protection systems have to make. Just to summarize, from static to dynamic, and then the introduction of special instruments, particularly for catastrophic medical expenditure, which insurance does not cater to. And as I said earlier, this ecosystem that comes under social protection organizations it has synergy with, but is not a substitute for disaster management frameworks, which have to be kept by appropriate agencies.
Thank you, Dr. Sania. Well, you have answered my question. Here is another question, and it is to the whole of the panel. And that's due to my personal experience while working as chairman NATRA. I wanted to ask this question, that when you create such state capacity to deliver social protection or introduce digital transformation that brings in transparency in the system, it can be politically destructive because it cuts the intermediaries to the size, bureaucratic intermediaries, and it can trample on rent-seeking groups. So how do you compensate the losers and empower beneficiaries? How do you build actually societal coalitions, both political and social coalition, that could support these reforms and sort of make them durable and sustainable, as we say in UNDP? So this is for Dr. Jemilah, Pia, and Sania both, if you can just comment on that, because that's close to my heart.
Yeah, I think that's a really difficult question to answer because it really depends on the context, right? I mean, if you are in Malaysia, for example, now, where, as I mentioned earlier, changes in government, trust, there is a trust deficit in many ways. I think the most important thing is, how do you then address the trust, and how do you build that trust? And I think this is where, I've been taking notes on, Service Canada and things like that, right? How do you use these digital instruments and technology to actually build a two-way communication with people? And I think the investment in building trust is going to be critical. At the end of the day, I think that when you talk about social protection and having the sustainability of the social protection system, like what was said by Dr. Nishtar, is not just having it exist in one facet of your assistance to people, but how it connects and how you build that almost that distributed network, right? Of whether it's a social protection system, connecting with your disaster management system, connecting with the as I mentioned before, your zakat institutions. How does it connect to corporate tax, corporate responsibility? So I think building that web and then the communication that needs to happen with people, and having those conversations, whether digital, social media, or face-to-face. Otherwise, I think it will be, I think that it will be very difficult otherwise, at least in the context of Malaysia.
Okay, and before somebody else can respond, we just received a question from Eddie, how can nations leverage great regional cooperation in establishing and implementing new policies? What are the common challenges in this initiative? So feel free to respond to that. And my earlier question, and I have a list of questions that Dr. Sania also mentioned, sent before the seminar, which I will actually cheat on. I asked actually 2 questions from that list, but there are more questions which are very, very relevant to what's going on right now with the rest of the world. And it's an opportunity to learn from those questions as well. So I'll ask those one by one.
All right, I might follow. Yeah. Is that okay? Okay, yeah, I'll follow. Please. So to your question, I might leave the regional one just for a moment. In terms of making these changes sustainable, I think partly public sector purpose needs to be at the heart of it. You know, what is the thing that the public sector is and should be uniquely responsible for, I think is a question, and what do people need from their public sector as opposed to from the government more broadly, as opposed to other sectors, I think is a question unique to each country and unique to each system, but a little bit common in terms of people's needs, and being able to ensure that how that public sector operates then is very much grounded in the values system of the people that they serve, which again is very different for each country. But what that means is it's not just about, you know, a lot of governments, a lot of public sectors have really adopted a lot of business language, a lot of business lexicon and methods, and that's fine. But underneath all of that needs to be, the heart of the public service needs to be strong and clear and aligned to the values of people, which means mechanisms to keep your finger on the pulse of changing values. Because as those changing values change, the public sector should be reflective of the values and needs of the people. So what this leads me to is continuous change. We need to ensure that our public sectors are designing ourselves over time, and that's not just our policies, but our systems, our organizational structures, our operating models, and certainly our systems need to be designed around the basic principle of ongoing, exponentially growing and continuous change. And if we build that principle into everything we do, then we start to do things like, yes, data-driven things, but real-time monitoring, building, looking for patterns analysis, looking for unusual and normal patterns, and being able to have the mechanisms to respond to those in real time, not in 6 months when someone does an audit. It means that we need to not assume, we need to move away from project-based funding, which says, I'm going to build a business case for a project, get the funding for a project, implement the project. By the time you started implementing, the basis upon which you got the funding has already changed. So how are we building continuous change into our budgets, into our programs, into our delivery, means shifting to services-based funding, funding of a service or funding of a product that is then continuously evolving. It means really thinking about and realizing how much we build static systems and static assumptions into our end-to-end process, our end-to-end policy delivery continuum, there are many points along the way that assumes a static point. You know, I've designed something and I'm implementing it, but how am I implementing it in a way that continuously changes to advance the original policy intent? A lot of implementation people don't know the original policy intent behind a service or a thing they've been told to put in place, and therefore don't measure for it. A lot of policy people don't have very much line of sight as to how something was implemented at the end of the day. So this leads to, if we want to design for continuous change, this leads to, I guess, two major things, two major mechanisms that might be helpful for sustainability of responsive governments. The first one is the concept of government as a platform, building the technical infrastructure, the policy infrastructure, building all of the infrastructure in loosely coupled modules, so that you get reuse of different components. You get the ability to adopt something new and switch something out and not be stuck on big systems that don't change. And the very concept that there are aspects for society for which government is uniquely responsible, such as legislation, regulation, laws, that we need to make available suitable for a digital age. We need to have digital legislation. We need to have an api.legislation.gov. If we just look at digitizing components of what we're doing, but we're not reimagining and revisiting the question of what is government in the digital age, and saying the foundations of which government provide for the rest of society need themselves to be available in a digital form so that they can be digitally consumed and then digitally delivered, then we will always have a translation gap between government, which is an analog beast at the moment because it was developed in the analog era, and the implementation, which is necessarily digital. So we always end up using people like a modem, and the whole point of a modem was to translate between an analog and a digital signal. We are currently using people and very large teams of people, and often lawyers, as modems between the basis of government and the implementation of government. And the second thing is, and I know that all different countries and governments have different appetites for this, but fundamentally openness is a really good enabler for scalability and for sustainability. Being able to figure out different ways of working reasonably openly actually provides mechanisms for citizen participation, for provincial participation, for cross-sector participation. There are areas that we do in government that I think are reasonably easy for anyone in any country to agree could be done fairly openly. And then there's, I think, different areas that would be different. I'll leave that there. Sorry.
In the interest of time, I would like Sania Nishtar, Dr. Sania Nishtar, to actually pose those questions to all of us that she has mentioned to ask. Your mic is muted.
So before I do that, I want to respond to this very important question that you asked about rent seeking and social protection programs and how you tackle with it. So basically, I don't know about other countries because I have not worked in, in that context, but I can say that when you have social protection programs, there are two dangers that you face. Number one is rent seeking, and the other one is the tendency to use those as tools of political patronage. And in my experience, there are loopholes that are systematically created to further these two objectives. So when you crack down on this and when you try to systematically close those loopholes, and when you try to push the needle on transparency and accountability, you get resistance. You get a lot of resistance because you're stepping on a lot of toes. There's a whole economy that thrives on rent seeking around the social assistance pipelines. And that economy is dominated by very non-bona fide criminal elements. So you will recall that when I talked about the SARS cash, I specifically mentioned the word cyber attacks.
Yeah.
This is something that we monitor on a daily basis. There's an organized economy, and there's a downside to technology as well. The more you automate, the more you facilitate, but then the criminal elements catch up with you. You create one loophole and they will find another, and you exercise vigilance, you try to plug that, and then they will catch up with you. And you constantly have to stay ahead of the curve. But what I wanted to say is that once, and I can speak from my own experience, because when I came, I tried to systematically close the loopholes. There were tight crackdowns, and I faced a very difficult time initially. But then our government is very committed to integrity. I had the backing of the highest office to do whatever was necessary to secure the system. And slowly and gradually, the benefits of that became visible, because even some factions who were used to the old ways of working within the political system saw that there's a benefit to doing things even-handedly. There's a benefit to doing things in a non-political way, because they can claim victory standing in their constituencies, that here is what we are delivering to you. So I just wanted to convey this sense that reform of cash pipelines, a reform of social protection systems, because it's all about money and who you give it to, is difficult. It's a difficult road, but it's a road worth going down, and it gives you dividends in the end. I also wanted to quickly touch on the regional collaboration question that you posed, Tariq. I think, I traveled the world when I was a candidate for WHO Director General, and I studied how regional collaborations were glued together, because I needed votes at that time. And so I had to study how regions worked. And I can tell you that our region is the least glued together. But there are regions in the world, such as the small isles of the Pacific and the Caribbean, as illustrative examples, who even have common regulatory regimes. They have common systems. And there's a huge advantage to be gained from that level of collaboration. But you were talking about experience sharing, and I think that the more that in South Asia, for example, our systems have a post-colonial imprint. We have common systems, but we don't talk to each other, which is a lost opportunity.
True. Dr. Sania, you wanted to ask some questions. We have like 5-6 minutes. The questions that we can.
Yes. So the questions, and I think that we may not have time. You may not have time to get answers, but I think that this opportunity that has been provided for us to speak together hopefully will be an entry point to longer term engagement. So I think the questions in no particular order are: what is the overarching social protection framework that your respective countries use? Secondly, how do you ensure that programs being run by different implementing agencies are working in sync? Thirdly, how do you target what is your targeting mechanism and your mechanism to identify beneficiaries? And how do you approach the question of cost effectiveness? And finally, what is your experience with social protection integration when you have a multifaceted landscape?
Yeah, first two, I guess we addressed and I asked, but very quickly, I think one of the most important questions that you wanted to ask was, what mechanism do you use to identify beneficiaries? So quickly, if we have examples from other countries, I think within the region we can learn if there is if there are good examples. You shared, Dr. Sania, our approach in Pakistan by integrated registries, by taking the data and running the data analytics, but to make sure that the targeted beneficiaries are real beneficiaries who are authorized for cash payment or in-kind payment. Are there some other examples? Dr. Jemilah also touched briefly on their Malaysia approach.
I think targeting is very similar. For us, it's about the database, right? Because of national registration, every Malaysian has an identity card, and we are now, in fact, in doing our census, and so the Department of Statistics also gathers a lot of data. And as I mentioned earlier as well, we have sort of categorized the bottom 40% based on the poverty level, the middle 20%. Now we are finding that the middle income group is being pushed into the bottom 40% as well as a result of COVID. So adjustments in that happens on a continual basis, looking at the database. So the targeting will be very much dependent on that. Now, with the My Social Protection Council now that has been established, I think what's very important is that it's going to bring multiple stakeholders, including civil sector, civil society, and so forth, so that there could be much more bottom up as well as a top down approach, and really having a verification as well on the ground. I think this is what's really important.
Thank you very much. Yeah, thank you very much. Another question was, actually we are running out of time, just 1 minute there, and I have actually shared the briefing of each panelist already, but here is the bottom line. If I would just summarize the discussion, because we promised that we won't take too much of your time, and it's almost 90 minutes. But the bottom line is, we discussed, if I have to give you the gist, is that natural disasters or crisis expose state fragility, we discussed, but also present a valuable opportunity for change. So these are the creative moments to transform governance through testing innovative technical solutions. We just learned from Dr. Sania Nishtar that today's SAS program is built on the platform of Benazir Income Support Program, which was established in 2008, but went through a learning curve by incorporating the lessons learned in IDP crisis in 2009 and flash floods in 2010. So if handled well, COVID-19 could allow us to radically transform and upgrade social protection regime of all these countries that we have learned. And we have learned from Malaysia, the B40M20 initiative and the Sukuk Islamic bond also, and from Pia that the lag between policy and service delivery is sometimes good, because it provides the due diligence required for targeted beneficiary approach. So I would invite Alex to say a few closing words, and it was
You're on mute, Tariq. Sorry, you're on mute.
okay. I was just saying that it was an honor and privilege to learn from the esteemed panel, and I would invite Alex to say a few remarks in the closing.
Yeah, thank you so much, Tariq. I think this was an excellent conversation. We tried to make it as, I would say, as intimate and close as well as productive as possible. And thanks so much for all the very generous shared insights straight from the field, from the trenches of putting in place social welfare system to respond to COVID. We obviously fully recognize that perhaps the time that was allocated for this wasn't enough to cover and to zoom in on many practical aspects. However, on our side, on UNDP, at the regional and UNDP country officer side in respective countries, we are happy to further facilitate more detailed conversation, to zoom in on the respective topics, both to support that regional sharing that was also mentioned during the meeting, but also to see how we can take the next steps in terms of social welfare systems that are being designed across the region, and how we can address those issues related to lack of glue and learning in South Asia and Southeast Asia in particular, as Dr. Nishtar mentioned. We are happy to take on this challenge to support you in this learning journey. We thank you very much. We really count on your continued interest to stay engaged with each other, and we are very much happy to facilitate it going forward. Thanks so much for our distinguished panelists, Dr. Sania Nishtar, Dr. Jemilah Mahmood, Pia Andrews, thank you so much. Thank you so much also, Tariq, for your moderation. And thanks for all the participants who stayed till the end with us. Wishing you all a very nice evening.
Thank you. Bye-bye.
Thank you, everyone.
Thank you very much.
Thank you, everyone. Stay in touch.
Thank you. Bye-bye.